Pressure increase with insulin resistance. Do you know why? Insulin effect. If you have insulin resistance, insulin hyperinsulinemia because you are type 2 diabetes, the hyperinsulinemia will enhance receptors of the adrenaline to react. Adrenaline is a hormone that will increase your blood pressure, increase your heart rate. So it enhances adrenaline release and receptor. The result is high blood pressure. Foam cells called in the atherosclerotic plaque. You know that insulin moves fats into the foam cell, and the insulin moves fats into the liver. So that is the common denominator, insulin resistance. And how do you develop insulin resistance and hyperinsulinemia? Pyramid diet. All patients with NASH have insulin resistance. Almost 100%. So you measure insulin level, it should be 10, but you can go up to 100. Very high insulin level. And abnormal ferritin values are seen in greater than 50%. Ferritin is the protein that carries iron in the blood. It contains about 23% iron. When it is there increasing, and an elevated ferritin level may be a marker of insulin resistance in NASH. Okay. The diagnosis of non-alcoholic fatty liver disease requires a careful history to determine the amount of alcohol used, and most investigators in the field of fatty liver disease require that less than 20 grams of alcohol be consumed to exclude alcoholic liver disease. So when you're less than 20 grams, siguro isa lang hindi ko matya, competition na lang. Okay. 1 gram, 20 grams, how many, 20 grams, okay. Almost 30 grams, okay, 1 ohms on 30 grams. Okay. Laboratory testing for hepatitis B and C, iron studies, and autoimmune serologies should also be determined. Then imaging studies can show characteristic features of a fatty liver. Okay? So imaging studies, but also some. But the ultimate diagnosis of either hepatic steatosis or non-alcohol steatohepatitis requires liver biopsy. Liver biopsy shows characteristic macrovesicular, large vesicles of fats, with occasional microvesicular fat being identified, and a mixed inflammatory infiltrate is found in the lobular distribution. The histologic features of NASH are very similar to those seen in alcoholic liver disease. Mallory's hyaline can be seen. They will appear as pink staining in both disorders. Although the number of hepatocytes containing Mallory's hyaline is frequently greater in alcoholic liver disease than in non-alcoholic liver disease. Steatohepatitis. Here he shows you the portal area. Usually the problem is in this area, and it is the ventral area. And you could see here marked proliferation, infiltration of monocytes, okay, in this area, showing to you. You could see there the vesicles, macrovesicles, containing fats, and here's the fat-laden globules, and inflammatory cells are surrounding the area. Here is a binucleated cell, dalawang nucleus niya, and over there it shows you the H stain, okay? Mallory stain, okay? Mallory body, which is pink in color. And here you can see also liver cells with these are the polymorphonuclears infiltrating the liver cells, and also here the liver cell contains Mallory body. And this pink staining is acidophilic characteristic of the condition. The fibrosis that occurs in NASH has a characteristic perivenular surrounding the veins and perisinusoidal surrounding the sinusoid distribution. Most studies show that NASH patient can develop advanced fibrosis with cirrhosis being identified in 10 to 15% of individuals. So, if you are a serious hepatitis, you can develop cirrhosis without even knowing it. Increasingly, patients are being identified with cryptogenic cirrhosis. Crypto, unknown. Parang multo. Crypto, multo, unknown, hindi kilala. Who have most likely had NASH for decades. These patients can develop liver failure and require liver transplantation. Okay, mamaya pakinggan yung pasyente ko na 5 million ang hinihingi sa kanya ng UPPGH for transplantation 2007, but by the grace of God, nandito po siya at buhay na buhay. No transplantation. And some patients can progress to the development of hepatocellular cancer. That is also the end stage of hepatitis, liver cancer. Andito rin ang isang pasyente ko. He was given only last August to live. But sinabi niya, I'm gonna live until I die. So he's still alive. So cheer. Increasingly, patients are being identified with cryptogenic cirrhosis who have most likely had NASH for decades. 10 years now, okay? Ultimately, the problem is it leads to cancer. Okay? Cirrhosis and cancer are end stages of fatty liver disease. The mainstay of treatment of fatty liver disease is weight loss and exercise, as I said earlier, which is often difficult to achieve in this population. As an aid to weight loss, orlistat, which is a reversible inhibitor of gastric and pancreatic lipase. When you say lipase, it digests fats. Gastric coming from the stomach. Okay? Pancreatic coming from the pancreas. Okay? That's the job of orlistat. Has been shown to result in a small decrease, small lump, I don't know, 1 or 10% decrease in body weight, and is usually fairly well tolerated. By the way, just to tell you, just a little bit cautious. I had a patient taking orlistat for almost 2 years. 2 years, right? Okay? Then when he came to me, siguro ayaw nito ba? Okay? Okay? Okay, come to take a note. Okay. It will block fat absorption. So, kaya? Okay. But the problem, he developed anxiety and depression. When he came to my clinic, he told me he was very much depressed for 2 years. He had been to so many, psychiatrists. So, from just plain obesity, he became a patient of a psychiatrist for 2 years. He was so depressed that he told me, Dr. Navarro, kung meron kang 45 caliber, barilin mo na lang ako. Gagawin na akong criminal. Sabi ko, okay lang, pero baka mawala naman ng hanap buhay. So I treated him. Within 2 weeks, Dr. Navarro, I'm very, very well ready. Okay? I told him to stop that, and I gave him the money. That's like a nurse who came to me. In my clinic at Specialist Hospital, sabi niya, Dr. Navarro, I have been under the treatment as psychiatrist for 3 years. And at this point in time, I want to commit suicide. That's a nurse. And she was about to go abroad. Then I told her, I treated her. I gave her high-fat diet immediately. Plenty of eggs, plenty of fats and everything, milk and honey. 2 weeks after, he came to me, Dr. Navarro, I'm going abroad now. Thank you. God bless you. Ang dali palang gamutin ng depression. Kasi pag hindi mo nagamot ng depression, lalabas dyan, signal number 1, signal number 2, number 3, number 4. Okay? Let's proceed. The mainstay of treatment of fatty liver is weight loss and exercise, which is often difficult to achieve in these populations sa Amerika. Walang pumapayat. Because if they take non-fat milk, lalo silang tatapa. Remember, the CLA says, pag walang CLA and non-fat milk, the more non-fat milk you take, the more you magugutom ka. So every hour, keep on eating, so tataba na. As an aid to weight loss, okay, all this stuff has been used. Okay, next slide. Bariatric surgery. You cut jejunal ileal bypass, tanggalin mo yung bituka, 7 inches ang bituka, remove everything, you leave only 7 feet. You remove only 1.5 feet. Okay? A fairly drastic maneuver for induction of weight loss. Recent studies have focused on the presence of insulin resistance at the center of the pathophysiologic mechanism NAFLD. So, insulin resistance, the treatment is low-carb diet. Stay away from pyramid diet. Now, the thiazolidine medications are PPAR, peroxisome proliferative activated receptors. The job of the PPAR is they will promote cellular development, okay, and proliferation of fats, proteins, and carbohydrates, but they are also tumorigenic. So drugs have been used to inhibit PPAR, or PPAR gamma inhibitor, which improves insulin sensitivity. The result, these drugs can improve what? Insulin sensitivity. So the result is good, right? The blood sugar will fall. Yes, peripheral blood sugar falls with the result of these drugs. Okay. Within the adipocyte and skeletal muscles. So that means the muscles can use sugar as energy. Okay, the fat cells can be burned by up-regulating specific protein kinases. Okay. So these are enzymes that are involved in transfers, involved in decreasing fatty acid synthesis. 2 drugs, maybe you know them, right? Propioglutathione, Actus. Have you heard about this? Not yet. Some mga diabetic patients, right? And rosiglitazone, Avandia, are currently available and are being evaluated as potential therapeutic options in the treatment of NASH. The parent compound troglitazone has been already removed from the market because of extensive mortality brought about by even liver damage itself. Okay, rosiglitazone is no longer allowed in Europe. They already banned this in Europe because of increase, according to the British Pharmacopoeia. They say that rosiglitazone is connected with a 16% heart attack, 23% congestive heart failure, and 14% mortality. Mataas ba? So 14% of the patients who took this have died already. That's why it has been removed from the market. But in America, they're using this with caution to the patient. Ingat ka, baka mamatay ka, hindi ka makabalik dito. Yan ang caution. Antioxidants have also been utilized. Dito mo, kawawa ang antioxidant, small studies. Ang mga antioxidant ko, walang budget. Kaya small, so 1% of the 99% study have shown benefit from vitamin E supplementation. Okay? They would like, but vitamin is very good. Treatment of hyperlipidemia with statin-type agents has shown improvement in liver enzymes, but they may danger yan. They have not been assessed for effects on hepatic histology. Sino pong bago dito? Bago? First timer? Okay, let me explain a little. Hindi na. Okay. For the sake of the first timer, I will repeat what I said yesterday. Kung sa inyo repetition, huwag po kayong magalit because God's method of teaching is repetition. Ulit-ulit. Basahin nyo, ulit ang ulit. What is the effect of statin? They block formation of cholesterol in the liver. Okay? They're an mevalonate reductase inhibitor. In the pathway, in the synthesis of cholesterol, you get cholesterol here, you block it here, you also block dolichol formation. You also block the formation of CoQ10. Okay, when you block dolichol formation, the result is you get cancer. Because dolichol is involved in normal gene formation, DNA. When you block CoQ10 formation, you get heart failure, you get weak muscles. Okay? And it also leads to rhabdomyolysis. What is rhabdomyolysis? In Tagalog, that is striated muscle. Myolysis, in Tagalog, lysis is naaagnas. Pag naagnas ang muscle mo, magkakabutas-butas yan. Because the cholesterol is a membrane-stabilizing antioxidant. You remove that, the result, your muscles become porous like this, butas-butas, and you are susceptible to cancer, you are susceptible to HIV, hepatitis, and more diseases. And from these holes will leak myoglobin, similar to hemoglobin, but this comes from the muscle. And the myoglobin will find its way to the kidney, and myoglobin is a foreign body of the kidney, and the result is what? Kidney failure. So you get, and if you lower your cholesterol, the brain is mostly cholesterol. The result is, according to one astronaut, he developed amnesia, global amnesia, because he was there up there. He lost control. He forgot everything, and he blamed it from cholesterol lowering. Per lipidemia with statin-type agents have shown improvement in liver enzymes. LGBT is totally false, but histology is mostly damage paid. Avoid offending causes like alcohol and or medications. Address other components of metabolic syndrome like hypertension, diabetes, elevated lipids, and obesity. Correct nutritional deficiency through diet modification. That is my approach, okay? High protein diet, high fat, and low carb diet. Yan ang approach na ginagamit ko. That is the opposite of pyramid diet. And proper supplementation. Administer rapid cellular balancing, a stem cell enhancer that promotes release of stem cells from bone marrow and make this available to the damaged, diseased, or dysfunctional tissues of the body. So it's very easy. Just take fatty liver, liver fibrosis, and cirrhosis. Only 3 stages, easy to manage. Cancer has 4 stages, liver has 5 stages, kidney has 5 stages, but liver has only 3 stages. Now we are in the final stage. Final common pattern for a wide variety of chronic liver diseases. The term cirrhosis was first introduced by Laennec in 1826. It is derived from the Greek word cirrus, the hardening, and is used to describe the orange or tawny surface of the liver seen at autopsy. Siguro parang citrus from that imagination, okay? In the past, it has been so that cirrhosis was never reversible. Oh, that is already past. We are now at the present, right? However, it has become apparent when the underlying result that has caused the cirrhosis has been removed, there can be reversal of fibrosis. So, remember, the doctor of the future will give no medicine, but will interest his patients in the care of the human brain, in diet, and in the cause and prevention of diseases. So my role is diet and identify the cause and teach my patient to prevent these diseases. So, you know already, one cause is alcohol, so get rid of that. This is most apparent with the successful treatment of chronic hepatitis C. So hepatitis C can be treated right now. However, reversal of fibrosis is also seen in patients with hemochromatosis, that is iron deposition in the liver, impairing the liver and causing even cirrhosis, okay? Who have been successfully treated, and in patients with alcoholic liver disease who have discontinued alcohol use. Cirrhosis as the end stage of chronic liver disease is defined by 3 characteristics. So under the microscope, and even not even at the microscope, you could see a render, or even the microscope, you will see there bridging fibrous parenchymal nodules, and disruption of the entire architecture of the entire liver. So you may not see a liver, a normal liver anymore. You don't know that liver, total disruption of the normal architecture of the liver. There are extensive fibrosis. These are fibrous bridging tracts between portal tracts it connects, it ends from one portal tract to another. Fibrous tracts, okay? Then you could see here the nodules, okay? The regeneration nodule. That means the liver still attempts to regenerate. So that means there is still a possibility of reversing, because you can still see area of trying to regenerate the liver, okay? Fibrous bleeding, regeneration, and yes, of course, the problem is more of hemochromatosis, iron deposition disease. So you can see here the nodules of regenerative hepatocytes. That means hepatocytes are still trying to survive the insult of, you know what is this? Fibrous tissue is no longer functional. Parang ito, during the, remember the eruption of the volcano? What is the volcano that erupted? Pinatubo, and there is lava. Okay, it's like flowing lava, and that areas are already, no more plants will grow in the area. Okay? So you can imagine the appearance like lava, and there are areas, mga faulty barrier that still survive. Liver cirrhosis causes alcoholism, number one. Chronic viral hepatitis, both Hep B, hepatitis C, but worse is Hep C. Okay? Autoimmune hepatitis, that means antibodies are produced to destroy the liver. Non-alcoholic hepatitis for those who are obese. Biliary cirrhosis along the biliary tract, the bile duct. Primary biliary cirrhosis, primary sclerosing cholangitis, autoimmune cholangiopathy, okay? On the biliary tract, the kidney, liver, cardiac cirrhosis. That means the cirrhosis is, the origin is problem in the heart. Remember I discussed yesterday, when there is ventricular septal defect, there is back pressure in the superior and inferior vena cava, the nerves is liver with the nerves. Ultimately, if the condition is not corrected by a surgeon, the result is cirrhosis. Inherited metabolic liver disease, like hemochromatosis, which defect in iron metabolism, Wilson's disease, defect in copper metabolism, alpha-1 antitrypsin deficiency, cystic fibrosis, and cryptogenic cirrhosis. That means anomia. Excessive chronic alcohol use can cause several different types of chronic liver disease, including alcoholic fatty liver, alcoholic hepatitis, and ultimately cirrhosis. Use of excessive alcohol can contribute to liver damage in patients with other liver diseases. Chronic alcohol use can produce fibrosis in the absence of accompanying inflammation or necrosis. Without inflammation, without necrosis, alcohol can cause cirrhosis, fibrosis, or whatever. So it's dangerous. Direct insult from alcohol. Fibrosis can be centrilobular, pericellular, or periportal, surrounding the portal. Okay. Whenever fibrosis reaches a certain degree, there is disruption of the normal liver architecture. You cannot identify the normal cells. And replacement of liver cells by regenerative nodules. You have seen the nodules, right? The round thing over there. And in between are the fibrous septa. Alcohol is the most commonly used drug in the US. Now they call alcohol as drug. That's what they say, okay? And more than 2/3 of adults drink alcohol each year. 30% have a binge within the past month, and over 7% of adults regularly consume greater than 2 drinks per day. In the United States, chronic liver disease is the 10th most common cause of death in adults, and alcoholic cirrhosis accounts for approximately 40% of deaths due to cirrhosis. So, 40% of death due to cirrhosis is due to alcohol. Here is the alcoholic cirrhosis pathogenesis, okay. Ethanol is converted by alcohol dehydrogenase with NAD, that is thiamine, nicotinamide adenine dinucleotide, is reduced to non-H as proton receptor to form acetaldehyde. Acetaldehyde is ultimately converted by acetaldehyde dehydrogenase to acetate. But acetaldehyde is a terror. That is a terror. Highly disturbing, and it will create all the problems in the liver. So from alcohol to acetaldehyde, that is where the center of the problem is. Okay? Now you look at this. That is chronic ethanol intake. Acetaldehyde is produced, okay, and ultimately it leads to increased lipogenesis. That means increased formation of fat cells and decreased fatty acid oxidation. So fats cannot be used for the formation of energy. Okay, that's why to enhance fatty acid oxidation, some medications have been given. Actually, it's not a medicine, it's a component, and that is carnitine or L-carnitine, because that is involved in fatty acid oxidation. Remember, I said yesterday that the heart gets its energy not only from sugar, but majority of the energy of the heart comes from saturated fats. And the saturated fat is broken down in the cells, okay, as a source of energy in what we call beta-2 oxidation. And the beta-2 oxidation does not occur in the cytoplasm, but in the mitochondria of the cell. So the fats have to move to the mitochondria, but the movement of the fat to the mitochondria must have a carrier, and that is carnitine. Carnitine forms actually fatty acid to form fatty acid carnitine and carries the fat inside, so it could be broken down to energy. Okay, and that is saturated fat. Next year, so that leads to acetaldehyde, you get immediately fatty liver. Okay, then there is also, it leads to oxidative stress, and the oxidative stress will act on the liver cell, and directly acetaldehyde can cause lipid peroxidation, and it will injure the liver cells. So what is the effect of the liver cell? It will increase suicide in the liver cell, apoptosis. Okay? Liver apoptosis will enhance. Another effect of this is the chronic ethanol intake is through the gastrointestinal tract. Okay? The alcohol will induce formation of gut-derived endotoxin in the gastrointestinal tract. You know the hepatocytes, the liver cells. These are the sinusoidal liver cells where blood flows, and this is the Cooper cell, okay, in the liver areas. Now, the gut-derived endotoxin will cause the Cooper cell to form cytokines, tumor necrosis factor interleukin 1, cytokine interleukin 6, and these are highly inflammatory. And these cytokines will activate stellate cells in the liver, and activation of this stellate cell, the stellate cell will promote collagen synthesis that will lead to liver fibrosis. So these are the manifestations of alcohol cirrhosis. Okay. The brain is affected. Okay. Let's look at the left side first. Effects of portal hypertension. That is, this is the portal vein, okay, which drains the pancreas, okay, drains the intestine, and drains the right side of the colon. The right side of the colon, and it drains into the liver. Okay, gets blood and pass it to the inferior vena. So if this is blocked because of cirrhosis, pressure will increase here, and fluids will move out of the intestine to the peritoneum and cause ascites. And the brains in the superficial area, this is the umbilicus, you will find around the umbilicus dilated brains like worms, like snakes coming out. That's why it's called caput medusa. That is the head of Medusa. You remember the Greek theology Medusa? Yeah. There will be esophageal varices. In the esophagus, around the esophagus, there will be collateral circulation. Because the portal vein is blocked, so there will be collateral circulation going through the esophagus, and the vein in the esophagus will enlarge, and that's called esophageal varices. And if they rupture, the result is you will throw out a lot of blood. You will bleed gastrotic. Peptic ulcer, melena, you will pass blood in the stool. Splenomegaly because of increased portal hypertension. Caput medusa over here. Ascites, as I said. Then dilatation of the hemorrhoidal veins, the result is hemorrhoid. Then the head, the brain. The liver, when there is intestinal putrefaction of protein, the putrefaction protein brought about by putrefying bacteria will release a lot of ammonia. Then you have to remove the putrefying bacteria. The Tagalog putrefying bacteria is putris na bacteria. Because it causes degeneration. And the putrefying bacteria will produce a lot of ammonia. So the ammonia will cause you to smell like ammoniacal, kumisan parang patay pag may liver cirrhosis ka. Amoy cadaver pag binusan ka. Paglapit siya, amoy patay. May cirrhosis to. Okay? That is ammonia. Kaya amoy, ammonia. Ang kanyang amoy, ammonia. Scleral icterus. You look at the eyes. If it is yellow, there's problem in the liver. If you are yellow and there is no yellow eye, that's only carotinemia. It's due to carrots, excess papaya, and other things. Spider nevi. That is a dilation of the blood vessels that often you find that, and often you find that in the palm, and that we call liver palm, and that is due to excess estrogen in the blood. Because estrogen is, by glutathione peroxidase, it will neutralize estrogen, it will neutralize insulin. Okay. Liver flap, asterexis cors hand tremor. Okay. And you look at the palm, it's what we call liver palm, it's pinkish because of estrogen effect. Bleeding tendency, decreased prothrombin. Remember prothrombin as is converted to thrombin, and it acts on fibrinogen to form fibrin, to form plaque. So plaque on prothrombin level falls, and you have prothrombin time is increased. Testicular atrophy, that is bad. Fall of the Roman Empire. Ankle edema. Okay. Now let's look at the other side. Encephalopathy over there, damaged brain. Okay. Malnutrition, skin, spider nevi, esophageal varices, year-day. Okay. Portal vein, hypertension, splenic vein, splenomegaly, this will enlarge. Okay. Umbilical, caput medusa, the head of medusa is there. Okay. Hemorrhoids over here. Testicular atrophy. Abstinence is the cornerstone of therapy for patients with alcoholic liver disease. In addition, patients require good nutrition and long-term medical supervision in order to manage underlying complications that may develop. Glucocorticoids are occasionally used in patients with severe alcoholic hepatitis in the absence of infection. So, if there is no infection, you can, the standard approach, that's not my approach, is to give corticosteroid. Other therapies that have been used include oral pentoxifylline, I discussed that already, which decreases the production of tumor necrosis factor and other pro-inflammatory cytokines. Okay? These cytokines will induce inflammation. So, cirrhosis due to chronic viral hepatitis B or C. So, let's go to virus command. Virus. Remember, virus can be prevented by unpasteurized milk. Unpasteurized. No more virus. No more Hep B. No more Hep C. No more. That's the way the Lord said, so that you may live long in the land that I'm going to give you to possess, a land flowing with milk. And they drank it, and they live for 900 years wala silang hepatitis. Of patients exposed to hepatitis C virus, HCV, approximately 80%, wow, very high, 80% of patients with hep C develop chronic hepatitis C, and of those, about 20 to 30% will develop cirrhosis over 20 to 30 years. At least matagal naman. Kung tinamaan ka ng 60 years old senior citizen, 80 ka pa mamamatay, okay lang. What about if you are very young? Hep C afflicts even 30 years old. Remember? If you are consuming too much, mas grabe. Many of these patients have had concomitant alcohol use. So, if you have hep C and you still drink alcohol, that's too dangerous. And the true incidence of cirrhosis due to hep C alone is known. Maybe it's due to alcohol, maybe it's due to hep C. In the United States, approximately 5 million people have been exposed to the hep C virus, with about 3.5 to 4 million who are chronically viremic. That means if you test for the serum, it's positive. Okay? Serum, hep B, hep C are positive. Okay? Antigen. Worldwide, about 170 million individuals have hepatitis C. What is the population in the Philippines? 100 million, right? Or more than this, almost double the Philippine population. So, with some areas of the world, like Egypt, having up to 15% of the population infected. Okay, that is what the cutaway model of human hepatitis C virus. What a beautiful thing. Parang laruan lang ng baby. Okay? That's the virus itself. Okay, we don't discuss that because we're not talking about viral diseases. If that's my assignment, I will discuss the detail. HCV is a non-cytophatic virus. That means hep C virus does not cause liver disease. It is there, but there will be no liver disease. So how is the disease produced? It is immune mediated. The result is you produce a lot of antibodies, excessive, that destroys the kidney. So that means very important is immunomodulation. Not too low, not too high. Okay. Progression of liver disease due to chronic hepatitis C is characterized by portal-based fibrosis. Fibrosis around the portal area, with bridging fibrosis and nodularity developing. In between the portals, there is bridges of fibrosis, and there are nodules, ultimately culminating in the development of cirrhosis. In cirrhosis, due to chronic hepatitis C, the liver is small, shrunken, with characteristic features of mixed micro and macronodular cirrhosis seen on liver biopsy. Remember that? Regenerating nodules, right? What that you showed. In addition to the increased fibrosis that is seen in cirrhosis due to hepatitis C, an inflammatory infiltrate is found in portal areas with interface hepatitis and occasionally some lobular hepatocellular injury and inflammation. Consider inflammatory macrophages, monocytes, and so on. Okay. This is micronodule, this is a macronodule. These are nodules where there is an attempt to still survive the effect of lahar. Three pictures of macronodular cirrhosis seen on liver biopsy. In addition to the increased fibrosis that is seen in cirrhosis due to hep C, an inflammatory infiltrate is found in portal areas with interface hepatitis, and occasions some lobular hepatocellular injury and inflammation. Now we are with a B. That is the model of the hep B over there. Okay, kung Christmas, napakagandang model to. Right? Like it's like parole. Okay. For Christmas, okay. Okay. Similar findings are seen in patients with cirrhosis due to chronic hepatitis B. For patients exposed to hep B, about only 5%. Remember, hep C developed 80%. Here it's only 5% develop chronic hepatitis B, and that is common in our country. And about 20% of those patients, remember, will go on to develop cirrhosis. With hepatitis C, up to 30%, up to 80% will develop cirrhosis. In the United States, there are about 1.25 million carriers of hepatitis B, whereas in other parts of the world, where hepatitis B is endemic, that means it exists continuously, like Southeast Asia. Are we there? Included, definitely, right? Sub-Saharan Africa, up to 15% of the population may be infected, having acquired the infection vertically at the time of birth from their parents, right? What is the incidence here in the Philippines? Elaborate on Department of Health. 20%? Is that 20% in the Philippines? From the Department of Health. Say U.S. incidence. Thus, over 300 to 400 million individuals are thought to have hepatitis B worldwide. That's almost 4 times of the Philippines, or 3 to 4 times. Approximately 25% of these individuals will develop cirrhosis. So what is 25% of 400? 100 will die of cirrhosis. Very high mortality, right? Million. Patients with cirrhosis due to either chronic hepatitis C or B can present with the usual symptoms and signs of chronic liver disease. Okay? Diagnosis requires a thorough laboratory evaluation. Quantitative hepatitis C virus RNA testing and analysis for hepatitis C virus genotype or hepatitis B serology to include hepatitis B surface antigen. If this is always positive, that means the virus is still there, floating. And anti-hepatitis surface antigen, anti-hepatitis E antigen, anti-HBe, and quantitative HBV DNA level. Management of complications of cirrhosis revolves around specific therapy or treatment of whatever complications occur, whether they be esophageal variceal hemorrhage. So the management is usually surgical to tie the bleeding vein, development of ascites, withdraw the fluids, okay, paracentesis, and edema. Usual management is to give diuretics, and for encephalopathy to give lactulose to remove ammonia in the intestine. In patients with chronic hepatitis B, numerous studies have shown beneficial effects of antiviral therapy, which is effective at viral suppression, as evidenced by reducing aminotransferase level, that is SGOT, SGPT, and HBV DNA levels, okay? Hepatitis virus DNA levels, that means, and improving histology by reducing inflammation and fibrosis. Several clinical trials and case series have demonstrated that patients with decompensated liver disease can, that means in the heart failure already, decompensated, right? Can become compensated with the use of antiviral therapy directed against hepatitis B. Current available therapy includes lamivudine, aldefovir, and entecavir, and tenofovir. Interferon can also be used for treating hepatitis B, but it should not be used in cirrhotics. Treatment of patients with cirrhosis due to hepatitis C is a little more difficult because the side effects of interferon and ribavirin therapy are oftentimes difficult to manage in patients with cirrhosis. So we'll see the side effects of those medicines at the last portion. Dose-limiting cytopenias, platelets falls, white blood cell falls, red blood cell falls, okay, or severe side effects can result in discontinuation of treatment. Okay, so these are the possible side effects. Okay, nonetheless, so platelets form. Platelets is responsible to prevent bleeding, right? Remember yung ating problem today, the Philippines is 10 again.